Madam President, members, this is a very sincere attempt to adjust MNsure. And I bring this to the chamber, to us, to take a very thoughtful approach to an issue, to a program that has been fraught with some serious issues. If you remember, Senator Lori, I stood with you over 2 years ago at the press conference when we unveiled MNsure and promised to work together to figure out this program, even though it pained me to go with a state exchange, but decided, okay, if this is the route we're going to take, and you were in the majority and still in the majority, then I was there to work with you. We introduced, or had at the desk, I should say, over 135 amendments when MNsure passed. And only one of our amendments was adopted. That was mine. I appreciate that, but it was only taken by half of it. The issue that I want to bring forward that we need to address is the accountability of MNsure and what are we going to do going forward, because obviously we have a program that has got some serious issues, as the OLA reports. There is a summary of the OLA report on your desk, members. You can take a look at it. And I remember one reason why DHS was behind MNsure and wanted to get it going was to leverage those federal funding to help build a human services IT system that was so desperately needed after we spent $41 million on the defunct Health Match program. And now we have a system where the functions are, for the most part, inoperable in the past, forcing the state to rely on decades-old legacy systems. We have counties that have had to do their applications by hand with a pencil. We've had counties that state the real burden has fallen on the counties that have had simple case loads or case management pieces that they should have taken maybe 5 minutes in the past. They're taking up to an hour. This is a serious issue when it comes to the cost and the website, which was approximately over $100 million. The enrollment figures currently are with medical assistant, 129,000, Minnesota Care, about 38,000. The QHPs are about 61,874. The initial projections was 500,000 members. They dropped those projections down to 100,000, then dropped them to 67,000, so they haven't even made their last current projections. Total enrollment, 219,772. That's current. The OLA report that came out in February, that came through both the House and the Senate and testified, was unflattering, to say the least. Enrollment website, this is some of the key findings I'm just going to mention to you, members. The enrollment website in 2003 launched with serious technical problems. They did not test the site and failed to use the state technical experts. The ambitious timeline on the state to develop the exchange, compounded with MNsure's staff withholding critical information from MNsure board and the departments, was another big issue. Another finding was they needed to, the target of the first enrollment period was seriously flawed and resulted in an unrealistic low estimate. And even with the initial enrollment lengthy with numerous technical problems that frustrated customers, the insurer and counties and many people who did buy insurance through MNsure have been satisfied, they said, even though we have the highest premium rate in the nation. There's a lack of accountability, and during the first year, the complaints of inadequate customer service compounded. There were real people that suffered real consequences. I'd like to point out a copy of the article from the Jackson County pilot, members, and this is from a constituent of mine. This is real people with real consequences. Her name was Gail Dunker, excuse me. And briefly, as it goes through, there are a couple from Jackson. They were hardworking, self-employed people that paid their own insurance, and Gail came down with breast cancer. They filed for MNsure. They thought they filed the appropriate forms. They worked with the county. Then the deadline closed March 3rd of 2014. In June, she went for an oncology appointment because she wasn't feeling well at all. She discovered they had no insurance, so she ended up paying that cost out of pocket. There was an appeal that was filed in August with, in between, subsequent visits to the doctor were denied continuously. So they did another appeal process over the phone in September. They told her that she needed to wait until November 14th when she finally found out that she had insurance, and it was too late. She went to the hospital. They've just been having a terrible time. Well, just to briefly summarize, Gail Dunker passed away on January 9th, 2015. She could not get the appropriate treatment. She could never find out if she had insurance. MNsure failed to respond. Letters were sent to the governor, to Senator Franken, with very inadequate responses. This is real people with real consequences, members. So I'd like to have you take a serious look at the A71 amendment. Because right now, this is what we need to do for MNsure. Putting it into a state agency, as Senator Lori's bill says, is very problematic for many of this, the majority, the Republicans in this room. This is not acceptable to create a whole nother state agency that has no accountability.